administering medication. And there's other ways that we could possibly give medication, like orally or rectally or topically and everything like that. But the main thing we were going to focus on, because this is what everybody always freaks out about, is injections, okay? So it's nothing to worry about. The video that I posted yesterday that I wanted y'all to watch today was kind of like an overview, all right? This is the actual, Pearson's PowerPoint walkthrough of the chapter. They want you to, be able to talk about the different medications, how that they enter the body, that kind of stuff. And we're going to keep all of that in mind. I want y'all to, when you take notes, to write this down. These are the ways that we, as a medical assistant, will administer medicine. Orally, that's through the mouth, the digestive system. Topically, that means on the skin. Vaginally, inside the vagina.
It isn't loading.
It's not on?
No, it's not. It's just stuck on the chapter 54. Yeah, there you go.
Okay, yeah, y'all can see it this way then?
That's better.
Okay, well then I'll just keep it like half screen. Okay, so orally, like I said, through the digestive, topically on the skin, vaginally through the vagina, rectally in the rectum, inhalation, meaning breathing it in, and then injection by, giving the patient a shot. All right, so those are the different ways as an MA. And yesterday in my video, I talked to y'all and I told y'all, and I've mentioned this several times, could you possibly be taught more ways? Yes. But don't ever think like, oh, okay, well, I'm going to go someplace and they're automatically going to teach me how to do an IV or something like that. No, a lot of doctors aren't going to do that. But you might be given the opportunity. Like I said, as many of my students have, they get in someplace and the doctor's like, hey, I'm going to teach you how to do this, or I'm going to teach you how to do that. And so they do learn other ways, okay? But as of right now, legally, this is how you can administer. Why would a drug be administered one way and not the other? Well, if you're wanting to get something to the lungs quick, what's going to be your fastest way? Inhalation, right? If you're having a yeast infection, what's going to be the best way? It's probably going to be to treat it internally in the vagina, around the area of the growth of yeast. So I gave y'all the rights. Has everybody in here looked over them? The right patient, right dose, right route, right. It was called the 10 rights. Did y'all see that?
Yeah.
Okay. That is your MA 10 commandments. Okay. And if I had y'all in the lab, I'm a very OCD person, and when I tell you that I check things 3 times, I check things 3 times. And I'm going to even share a story with you. As a paramedic, everything was life and death for the most part, and I had a MA student ask me, Miss Scalf, when you were running a code and somebody's laying there dead, did you really check your medicine 3 times? I did. And it might have been while I was picking it up, pulling it out. Most of them are in boxes, color-coded type boxes, pulling it out, and and they're pre-filled, a lot of them. And while I was doing that, but yeah, I really did. And it might have been like a quick, fast emergency response type of action, but it is something I did. And another habit that I want y'all to have is I want you to be responsible for anything you might come in contact with. And I know that sounds like, what? So if you get to the office and things are in disarray, even though you didn't leave them that way, but if you're going to be working in those rooms, clean it up. because that's how we do things. Our patients, I mean, we give our patients the absolute best quality we can give them. If you go to a room and something's not stocked and supplied, that is, even if you're not the one that used the last bit of it, you're going to supply it just because it's the right thing to do, to have that for your patients, to have that for the doctor. And I've had a lot of students go, well, why didn't the person who did this or did that or left a mess do it? I don't know. But you know what? In the long run, it doesn't matter about that person. If that's the kind of habits they have, let me tell you, they ain't gonna be around long. I promise you that. And but that MA that does do that, and you may not get recognition, and nobody might say anything, but eventually somebody's gonna say, hey, these are always stocked. This is always this way. And I really appreciate that. And I saw that you were doing that, you know, and you're not doing it for the recognition. You're doing it because if your doctor's there, that doctor needs to be able to have the equipment they need. If you need equipment, it needs to be stocked in the room, in the lab, in the y'all's workspace. So that goes back to setting and instilling that good base, that wonderful foundation. And that's what medical assisting does. And if you're trained right as an MA and you work and you build on that career, you'll always have a solid foundation just to work from, okay? And when I tell you the first step is make sure that your supplies are ready, that you know your orders, and that make sure that you have an understanding. Never be afraid to say, could you explain that to me? Never be afraid to explain. And this is how we always word things. Say there's a machine you don't know how to use. You don't say, I don't know how to use that. That doesn't look good on you. So how you're going to say that is, I know we learned how to use this, but for the life of me, I don't remember. Could you refresh my memory? Or you could say, hey, we had a model like this one, but this is a newer model, or this is a different model than what we had. Could you show me how to use this particular centrifuge or this particular autoclave? And that's me going kind of off topic, but just remember, don't be afraid to ask. And if you're not comfortable doing something, and this goes with the whole medication thing, if you do not feel comfortable for whatever reason, never be afraid to say, I don't feel comfortable. Can I get assistance? It doesn't make you look bad, okay? So this is saying here, first step, make sure everything's in order. Make sure the order that you've been given from the doctor, that you completely understand it. All right? So, and then the next thing we're going to do is we're going to look at the patient's chart. And so say the doctor is ordering a 5 milligrams of, what's a common steroid? Solumedrol. Okay. We'll just, that's a common steroid. So, and they want the patient to have that for, you know, inflammation and swelling and pain and so forth. So you're going to look at the medication when you're taking it off the shelf, and you're going to see, okay, here's the Solumedrol, and okay, I'm checking the bottle. I'm looking at its expiration date. I am checking that it is the correct medication. I'm making sure that it looks clear. There doesn't look like there's anything floating in it or that has grown in it or anything like that. So that's my first check. And then second, I'm going to take a look at my patient's file. Are they allergic to anything? All right. And I'm going to make sure that there's no drug interactions. Next is then I'm going to check the order again. I'm going to look over there at the doctor. Okay, I'm looking at the computer screen or the file or whatever. The doctor wants 5 milligrams Solumedrol, however. So Yes, that is the order. I'm going to pick up that medicine again, and I'm going to look at it. Yes, this is Solu-Medrol, and I'm going to make sure. And then the next thing is I'm going to run through them 10 rights, and that's why I posted that to y'all. I want you to have them. And when it tells you that a medicine has to be checked 3 times, it really honestly does, okay? Before the medicine's removed from the cabinet, before the medication is either poured, drawn up, or placed in a cup, and then, excuse me, before the medicine is either returned to the cabinet or administered to the patient. Now, sometimes if it's pre-filled, you won't be returning it to the cabinet, you'll be administering. So those are the 3 times, okay? So and that's an always, without fail. And this says 6 rights, but I'm a little OCD. So like I said, we got the 10 commandments, but it's right patient, right med, right dose, right route, right time, right documentation. And all of these are something every single time you're going to run through your head, because you cannot afford to make a mistake. And a perfect example is I had a student who was working at an allergy clinic in Texas, and just like Florida, the allergies are horrid. And some big man, he was like, 350, big guy. And he was like, she said he was like 5'5". So he was coming in for allergy shots because he was severely allergic to pollen or something. And so they were trying to get him immune. So he'd come in, how they do allergy shots is you come in and you get a wee tiny dose. And then the next time you come in, you get a tiny bit more. And then the next time you get a tiny bit more. And they make these ahead of time, and they had the patient's name in there. She had the right patient, but she had the doses backwards. And she didn't check. And she just picked it up, administered it, and gave it to him and sent him home. And it was the last dose. And she said, I realized it when I went to go put the container of his meds back up. And she said, Miss Galva, the only reason I did it, we were so busy. And I know you always told us, and because she called me first. I was like, well, first of all, you got to get off the phone with me, and you need to go talk to your supervisor. You need to explain exactly what happened. And she's like, I already called the patient and asked him how he was doing. He's okay. I was like, okay, get off the phone with me. And if if a mistake does happen, and the first thing you do is contact the person ahead of you. And it's usually go straight to the doctor, right? And let them know. And you don't do that in front of the patient, okay? And you do that in private, and then you let the doctor handle it from there, okay? But do you see why the importance? That could have put him into anaphylactic shock and had all kinds of issues. Or imagine if that was a 6-month-old or 1-year-old coming in for their MMRs, and you gave them double the dose. That happened with a set of twins. The one parent had taken the baby out to change in the bathroom, and the other parent was there. The inmate came back in and ended up giving the one twin both sets of the yearly vaccines, like double the doses to one of the babies. So mistakes like that can't happen. And that's why we as MAs, we have to stay on top of that. We have to make sure. And this is where OCD isn't a bad thing, okay? Because we're checking things and we are rechecking them, okay? And now here's the other, because it does talk about, the 10 rights, the first 6. The other 4 is, does the patient have the right education? We want to educate our patient. And one of our biggest jobs as an MA is patient education. So if we're teaching them, let's say we're going to give them a dose of insulin because the doctor's ordered it. So we're showing them in the stomach and how to rotate the area and how to cleanse the area, and showing them how to use the pre-dosed vial, or even if they're having to their very first time. So we want to educate them and teach them about this medication and how to use it, and how we're basically going to teach them how to do a sub-Q injection. Tell them about the 45-degree angle. That's why when I tell you, you need to know how to do this, it's because we do educate our patients. We spend more time with our patients than the doctor ever will, okay? Another right is the patient's right to refuse. So Miss Jones comes in and she says, hey, I'm here for my flu vax. All right. So you get it drawn up and you're ready and you go in there. And then all of a sudden she's like, you know what? I don't think I'm going to do that today. Okay. All right. Let me let the doctor know and we'll notate that on your chart. Now, of course, you go let the doctor know. And he might come in there and tell her, oh, Miss Jones, you know you need this, and we don't want you getting the flu. But you didn't push it. You didn't force it. And that's something we never do. The patient has their rights. Now, it's a little different when it comes to children and infants and that kind of thing, because they're going to tell you no. And they're not going to just be telling you no. They're going to be screaming, kicking, hitting, spitting, biting, and, you know, that's why hopefully we always get mom and dad or some guardian involved, and they're going to be refusing, but their refusal doesn't count. Okay, it sounds horrible, but we're doing, you know, what's best for them. And then the right assessment. The right assessment basically means after you've given that patient, or even before you give the patient, look at the area where you're going to give the injection, or make sure that the person doesn't have any wounds, injury, previous bruising, or anything like that. And then write evaluation after it's been given. You never let a patient, if you administer medication, a patient is going, you need to write this down. If you administer medication, a patient is going to stay in your office. It might be in that room, it might be in the waiting room, but they're going to stay there for a minimum of 15 minutes. And that's law. And that's to check to see if there's any kind of adverse reaction, like anaphylaxis. Now, some doctors wait longer. They say 30 minutes. But they'll say, go have them set out in the waiting room, and, you know, once the time's up, and somebody will holler at them and tell them, all right, you're good to go, you know. But it's to make sure, it's a safeguard, right? Medical assistance, like I said, we do not legally have the ability to give medication IV. We do not legally have the ability to administer chemotherapy drugs or narcotics. That being said, I do have an MA in Texas named Aisha, and she works for a doctor, and she does IVs, and she does IV medications and stuff like that. She is an MA, but her doctor that she's worked with, God, it's been 5 years. She taught her and showed her and trust her. They have a relationship, and she works under that doctor's umbrella. So there are exceptions. And now, could she go someplace else and just because she knew how to do it and automatically do it? No. That's that doctor, that particular very special scenario. You see what I'm saying? All right. But in general, we do not do this. And the reason is because when you put a medication into a vein, it is instantly in the cardiovascular system. All right. and chemotherapy for obvious reasons, and narcotics for obvious reasons. Now let's talk about oral medication. We're going to get to these. It's swallowed, all right? And it enters through, you know, how we've already gone through digestion. We've talked about how it makes its way through the esophagus into the stomach, and how our stomach's acids dissolve it, and then it's basically absorbed from there, just like our food, but it's absorbed into the bloodstream, and then it goes and does its job. Now that can orally can be a pill, it could be a syrup, it could be a liquid, right? So there's different ways, but when we think orally, we're thinking something that is sent via the GI tract, okay? Liquid medicines come in many forms. There's suspensions, emulsions, elixirs, syrups, and solutions, oh my. And we'll learn about all of those when we do pharmacology. Now, when we administer an oral medication, it's vital that we look and we see what unit of measure, you know, what unit or dose of measurement is being ordered. Is it an ml? Is it a gram? Is it, you know, it's really important that we see that and that we recognize that. So when we go to administer, a lot of times we use syringes for babies without the needle, because it's easy to put it in their mouth and then just squeeze the medicine, and then the mom or whatever holds the mouth and little lips close, and if you're lucky, they don't shoot it out their nose. But when we do this, when we pick up our device that we're going to use to measure the oral medication, it is vital that not only you've checked that medicine 3 times, something even as simple as acetaminophen, Tylenol. A baby comes in with a high fever, the doctor says we're going to give them some Tylenol. You're going to check that Tylenol 3 times. Plus you're going to check the dropper or syringe or cup that you're giving, and you're going to make sure that it's going to be able to give you the correct dose. And those kind of medications, especially for babies, are done by weight, okay? And then proper education on these medications. And that's where, once again, you're educating your patient. I cannot tell you how many times you hear stories in the medical field about parents accidentally poisoning or even killing their children because they've given them the wrong doses of medications. And so when we educate our patients, we want to make sure we explain to them that, mom, don't use a regular teaspoon or tablespoon from home. This is going to come with a measured cup. Make sure you wash out this cup and keep this cup, and or spoon or syringe, whatever it comes with, right? And that you always use this to deliver the medicine. Make sure that you always check and that it's right at, and show them the level, you know, that this is the amount that you want to administer. And because something as simple as acetaminophen, if there was a case of a parent who was giving their infant adult strength acetaminophen for fever, and they killed their liver, the baby ended up needing a liver transplant. And there's been cases of Benadryl. Benadryl happens often, thinking that, okay, well, more is better. And there's Benadryl as an antihistamine, but it also has a sedative effect. So what ends up happening is the child falls asleep, and it's over. If they give too much, they forget to breathe. And that happens a lot more than you'd realize. So educating your patients. If a medication needs to be kept in the fridge, hey mom, keep this in the fridge. or mom, this needs to be kept in the dark, or, you know, whoever. Make sure that they understand what are the rules and the instructions as far as giving these medications to their children. It may not be a kid, maybe it's their mother or their own father. They're taking care of somebody, or maybe it's themselves. All right. So we make sure we educate our patients properly. And this is showing you dropper form. And then this is like what I like to call the measured spoons. And here's a cup, and then a syringe form. This is what I preferred with when my babies were little, because like I said, I'd always trick them, get them laughing, doing something goofy or something, and then squeeze it in through the cheek, and then pinch her little nose and close her little mouth until they swallowed. I was one of them moms. Oral medication, it can be also administered. We're putting it in the mouth, but there's other ways besides directly swallowing it. And I'm going to wrap, I know we're at 32 minutes, but one of them is oral and we call sublingual, and that means under the tongue. You would not believe how fast leaving a medication under your tongue sublingually will dissolve and enter into the bloodstream. This is a highly vascular area, and it is rapidly dissolved and entered. Is it as quick as something intravenous? No, but a lot of fast-acting migraine medications and stuff like that are sublingual. And so you'd explain to the patient, hey, this is a sublingual medication the doctor's given you. You're going to leave it, you're going to take it out of the package, place it under your tongue, let it completely dissolve there. And that's that. A buccal, and that's what this word is, buccal means that we're going to tell the patient, this is not as common. We're going to tell the patient to take the medication and place it in their cheek. Like if somebody had like chewing tobacco, and they can place it up here in the top of the gum, or they can place it over here in the cheek area. But what we want is it's a little slower than sublingually, but yet it's not being sent through the GI. It's still being absorbed there in the mouth area. And that's called buccal when it goes up here in the cheek area. And then I'm going to stop there the day for here. Does anybody have any questions?